Thank you very much. The introductions have been done already. But for my presentation to make sense, I think I need to introduce our situation first. Malawi is a poor resource country in terms of personnel to do surgery, the infrastructure to deliver surgery, the equipment, and even the supplies. And the problem is mainly waste in the rural areas because the 80% of our population is rural based. And this rural population is scattered by what we call district hospitals, and in those district hospitals, there's no specialists resident there. We have non-physician clinicians called clinical officers who deliver the surgical care in these districts. And for the few number of specialists that we have, all of them are based in urban central hospitals, which act as a referral hospital for all these district hospitals that we have. So I've introduced about our situation in Malawi. 80% of our population is rural, and the rest of the specialists are in the urban central hospitals. So to support these district hospitals, we created a forum where we had all the specialists in the group, all the anesthetists, and all the clinical officers in these rural district hospitals, so that when the district hospitals are presented with a surgical case, before they decide to refer to the district to a central hospital, they will post the case on the forum for specialist advice. So these clinical officers and who provide surgical and obstetric care for every patient that they feel should be referred to a central hospital, they will post it on the forum, and the specialists on the other end will respond on how best they can manage that particular case. So just to give you a feel on how things have gone, I'll play a video by our specialists as well as the clinical officers on their experience in this project.
We tried to come up with a way of connecting the district hospitals with the consultants at Queen Elizabeth Central Hospital. So WhatsApp group was the idea that we came up with.
I think it's being very effective at that because it's kind of instant consultations. People with questions are getting feedback from a specialist almost immediately.
We post even the pictures, and the consultants do see the pictures, and they can advise to say, well, proceed to this side so that you are able to reach the problem.
You give feedback immediately, you say, deal with it there, do this, do that, or, do these investigations and call us, or send the patient up, or sometimes don't send the patient up.
We find it very useful because we notify them in advance so that they should get prepared.
You need to discuss the cases even before you refer them. They say, oh, well, Mr. Malunga, before you refer the patient, do A, B, C, D, E, because this patient has to arrive in Queens once in a safe condition.
It's pretty helpful in terms of giving them advice. For example, if it's something that they can do at the district hospital, at least you'll be able to give them advice on what they need to do for the patient before they refer, or at least as they refer.
When we send the patients, we get even feedback right away on the WhatsApp forum.
I love the feedback and even in the teaching itself, because medicine is dynamic. Each and every day you need to learn.
We have got 10 district hospitals, and in terms of membership, individuals, we have got 100 individuals, almost 100 individuals in the group. They have access to about 14 consultants. The good thing about the WhatsApp group is that once they post a case on the group, 1, 2 or more consultants will contribute on the case, which creates that access to many consultants at once.
We're not reaching only to one person, so you reach out to quite a number of clinicians. So as much as I may advise one person to prepare the patient in a certain way on a specific patient, I'm sure somebody else is also learning from the same group.
The best thing is that not only that we are given feedback, but also we are learning.
There was quite a big gap between us and them. But now the WhatsApp group, basically, we've come like a family. we can interact, we can communicate, and they're not afraid to ask for medical opinions, surgical opinions.
It's a no-cost thing. It just takes people's time. There's no money invested in it, so there's no reason for it not to continue.
Through SURG-Africa, these are happening, and that's what Minister of Health is supposed to do anyway, and the Central Hospital is supposed to do, and SURG-Africa is just helping, coming in the right direction at the right time.
And just to give you a bit of results from the data that we have analyzed, we have noted that for the advice that the specialists gave the DC hospitals, about 60% of them, of those referrals that they consulted, they were advised to refer right away. But we also see that about 1/3 of the referrals, they were told either not to refer or to refer but later. This means that the case should have been handled at a DC hospital, or even if the patient was referred, couldn't have benefited from specialist care. So this referral system that we try to implement using the WhatsApp group has really improved on the sending of appropriate referrals to central hospitals, and also presents an opportunity for cost saving for hospitals, because every avoided referral is a saving to a DC hospital. And also this access to timely and affordable surgical care for the limited number of specialists that we have resident in the urban area is really feasible with the WhatsApp group forum. And also, as you saw in the video, the mentorship that is happening through the WhatsApp group, through the physicians, the specialists, explaining why a case should be referred or not, is really helping our referral system, especially on these surgical cases.